Good afternoon, bonsoir, et bienvenue, welcome to everyone. We're super happy to have all of you here with us today. Those of you who are here in person and everyone who's on Zoom. It's an honor and a great pleasure to welcome you to the 2021 Stewart Gloyd Endowed Lecture. The Gloyd Lecture was originally established in 1982 by Professor Lynn Staley of Children's Medical Center to honor his mentor, Dr. Park Gloyd, in recognition of his many years of service to the Department of Orthopedics at what was then Children's Orthopedic Hospital. In 2001, Park Gloyd endowed the lectureship and then renamed it as the Stewart Gloyd Endowed Lectureship to honor his son, Dr. Steve Gloyd, who is with us here today and has been a pioneer in global health at the University of Washington. Regrettably, both Professor Staley and Dr. Park Gloyd passed on this year in their older age. We're happy to have Steve Gloyd here with us. He is a professor in the departments of global health and health systems and population health here in the School of Public Health, and also adjunct professor in epidemiology, family medicine, and industrial and systems engineering. Steve created in 1987 the International Health Program in the School of Public Health, and subsequently co-directed the strategic plan that resulted in the creation of the Department of Global Health, where he was the inaugural Associate Chair for Education and Curriculum. In that role, he continued as Director of the Global Health MPH program and led the creation of the Global Health PhD program. Steve has been widely recognized for his approach to teaching and mentoring. He is also the founder and past Executive Director of Health Alliance International. Steve has been a long-standing champion of social justice and equity, both locally and around the world. He has been the recipient of many awards, including being honored as the 38th UW Faculty Lecturer, awarded to one of the UW faculty, to just one UW faculty member per year, whose research, scholarship, or art is widely recognized by their peers, and whose achievements have had a substantial impact on society. He also received the UW-wide Distinguished Teaching Award and the 2010 Barsky Award for Courageous and Effective Advocacy for Human Rights, selected by the American Public Health Association's Physicians Forum. It is thus fitting to have this endowed lecture to acknowledge his contributions to global health justice. We are honored to have with us here tonight members of the Gloyd family, including Steve's wife, Awa Kone, hi Awa, and their children, Musa and Salim. I also want to thank the 2021 Gloyd Lecture Selection and Organizing Committee, Mary Ann Mercer, Amy Hagopian, Awa Kone, Jean-Jacques Muyembe, Darren Wade, and Basia Otto for their perseverance in making this year's lectureship happen despite the numerous challenges due to the COVID-19 pandemic. The Gloyd Lecture brings us speakers committed to global health justice and has become a highly anticipated event at the University of Washington. Past lectures include Jim Young Kim, Bill Fagey, Representative Pramila Jayapal, and Emmanuel Byrne, Mary Bassett, Helene Gale, Richard Horton, Alfred McCoy, Nina Wallerstein, David K. Johnson, Sanjay Basu, and Io Garrido, and Stephen Lewis. So this year, we're extremely honored to have as the Stephen Gloyd Lecturer, Dr. Jacques Muyembe Tamfum, Monsieur le Directeur. We're going to allow Steve Gloyd to do the honor of introducing you. Mais bienvenue. And Steve, I'll turn it over to you.
Thank you very much, Hillary. I think I'm going to take my mask off because I think we're okay doing that here. Thank you. Thanks, Hillary. Thanks all of you who are here. Thanks for your kind words and your support of this lecture. A big thanks to my late dad for making the lecture possible, and to my late mom, who kind of kept everything together, and her unfaltering support through the years and through my circuitous journey. And a big thanks goes to my wife, Awa, who, where are you again there? Who keeps me humble, honest, and grounded. And my kids, who don't let me get away with anything, who in fact aren't here, but I think they're both Melissa and Salim are on Zoom, hopefully, and they can criticize us all when we're done. Big thanks to, again, a thanks to the Dean's Office, thanks to you, Hillary, thanks to the folks in the Dean's Office, huge thanks to Basha Otto, who really kind of made this all happen, to the committee that Dean Godwin mentioned, and also special thanks to Deepa Rao, who was the person who actually alerted us to some of the issues around Professor Muyembe and got us on his trail. So we were very appreciative of that. And then a shout out to the students and the faculty of our department and schools, who are, like all of you, a constant source of inspiration, who challenge us, that is our faculty, in our thinking and lead us in the struggle for global health justice. This lecture is, I think, a great opportunity to bring to the UW voices from the Global South who can teach us about their struggles for health justice. And it's an opportunity, I think, to learn from their stories, especially to question our own conventional wisdom about what works and what doesn't work in global health, and to address the questions that we often avoid. We all know that the struggle for health justice is not just about technological innovation. It's not charity. It's fundamentally a political struggle, and that where we need to fight for a more just and equitable world. And I think Professor Muyembe is a great example of somebody who has led that fight in his own country. Let me say a little bit about Professor Muyembe. He is a widely recognized microbiologist, known for his key role in the discovery, prevention, and currently in the treatment of the Ebola virus. He's described in the Lancet magazine as Africa's Ebola hunter. He's currently the general director of the National Institute of Biomedical Research, the INRB, in Kinshasa, the Democratic Republic of Congo, DRC. And is a professor of medical microbiology, virology, and in the faculty of medicine there. He currently heads a team of researchers studying everything from sleeping sickness to the Congo virus and surveillance for measles, yellow fever, polio. So it does a huge amount of stuff in that realm. I think in terms of what is known about him in a global scale, he led the first research team that identified the Ebola virus in 1976 by being the person who actually went into the field, did the clinical work, collected the samples, would have analyzed the samples, but there was no capacity to analyze those samples in Kinshasa, so organized a team of folks in the UK, in Brussels, and CDC to be able to analyze the samples in laboratories that had the facilities to do that. And therefore is arguably the discoverer of the Ebola virus. I thought today that with some of the information that's come out with NPR and others about Professor Muyembe, they said in a 2018, I think, or 17 statement that if you Googled who was the discoverer of Ebola virus, what you would find is 3 or 4 mentions of white men in Europe and in the United States. And so I thought to myself today, okay, I'll try to do it today, but I bet that won't be the case because there's been a lot of talk about, this is inappropriately attributed. And so I did it a couple hours ago. And what did I get? Same old thing. The first 4 pieces I got were, Peter Piot, the folks at Brussels, because they were always fighting with people at CDC, et cetera. And the first reference, which was the fourth hit that I got, was the University of Washington, the communications department of, I think the department, that basically mentioned that the true founder or the true discoverer of Ebola was Professor Muyembe. So I feel a little bit honored that our own Department of Global Health was actually, is trying to dissuade the rest of the world that the truth is. 2016 led an effort to develop what's a drug called Ansuvimab, I think it's called, which is a monoclonal antibody treatment for Ebola, which was successfully used in DRC's most recent Ebola epidemic in the EDRC. And I think he'll tell you a little bit about some of the politics around being able to do that. But so it's not just the discovery of Ebola, but he's been doing Ebola work since. His work has saved lots of lives, especially through his recognition of the social cultural dimensions of Ebola and other pathogens, and that infection control means prioritizing community engagement when you're attempting to stop epidemics. His first action when he arrives at an outbreak, was written in one article, is to call a meeting of local community leaders and chiefs to contextualize the situation and understand in local terms what's going on. Professor Muyembe was educated. He's from a family of farmers in rural Bandungu province in the DRC, went to Jesuit schools, got his medical degree at Lovanium University. He got his PhD in microbiology from the Riga Institute in Belgium. He's been the dean of the University of Kinshasa Medical School, the Institute. He's been in the Institut Pasteur. He's been around a bunch of places. And he's gotten a tremendous number of awards, interesting enough, all starting in around 2015, whereas the Ebola discovery was 1976. So in 2015, he got the Royal Society of Africa Prize, same year, the Christophe Meroux Prize, the very prestigious Hideo Noguchi Africa Prize, that's given only every 5 years. He was in Nature's top 10 in 2019. The 2020 group included Anthony Fauci and Tedros Ghebreyesus, so he's in pretty good company, I think, with that group. And he was Time Magazine's 100 most influential people of 2020. So somebody's beginning to recognize Professor Muyembe. So you can see he's an incredibly accomplished man who took huge personal risks in his role that identified the Ebola virus. But it's not just recognition. He understands, having both the experience that he has and by heading up a major research institute, Biomedical Research Institute in Congo, what partnerships mean, what it means when the powerful North comes with some ideas and makes a partnership with an institution in the South, and how equal it really is in terms of budget, in terms of communication, in terms of decision-making. And I hope that he will share that with us today. Professor Muyembe is going to speak to us about all these issues with the title Challenges with Partnerships and Scientific Recognition in the International Settings. In the case of Ebola, he will discuss the consequences of scientific exploitation, especially in African scientists, and what he is doing to ensure that African scientists are part of writing Africa's future. So please give a warm welcome to Professor Jean-Jacques Muyembe. As Professor Muyembe is coming up, I want to also introduce Jean-Jacques Kayembe, who will be doing some translation. Out of respect for Professor Muyembe, whose first language is French, he's going to be giving this in English, but if there's any hiccups that we have, Jean-Jacques here with us for a translation.
Okay. Yes, Madam Dean of School of Medicine, dear Professor Stephen, dear Professor and members of selecting committee, dear students, ladies and gentlemen. It is an honor for me to be here this evening. I want to thank the Department of Global Health and Steve Gloyd for selecting me for today's lecture. It is a challenging time with the COVID-19 pandemic, and I would like to express my gratitude to the organizing committee and the entire scientific community of the University of Washington. These few words are to express my profound gratitude. Coming here this evening is a recognition for my work and an opportunity to reconnect the Democratic Republic of Congo with you. The DRC indeed has many challenges. I am here as an ambassador telling you that my country needs your support. Support that considers the colonial past and our shared heritage to build a new and well-defined partnership where institutions like yours offer the expertise that will benefit a country like mine. I am glad that this institution, especially the School of Public Health, opened doors to Congolese students. This is one of the essential steps of building partnership, training a new generation of global health advocates. Although I will share my experience, I want first and foremost to affirm my commitment to equity and social justice, which for me is essential if we want to build a long-lasting partnership. Lastly, this evening, I want you to join my effort of creating a sustainable collaboration between my institution, the Congolese scientific community, and you. I am director of the National Institute of Biomedical Research, we call INRB, in Kinshasa. And I am also the president of the Congolese Academy of Science. So thank you. Thank you very much for your presence at this conference. I will not give a conference like this, but I want to have a dialogue with you. So I will share my experience, and I will be very happy to hear questions, to receive questions from you. Okay, so ooh. So the DRC and many African countries has infrastructure and system inherited from colonization. And scientific research was carried out by Europeans and aimed essentially at the establishment of higher education, study, and research institutions tailored on the European model. So education system tailored to meet the colonization needs, mostly, and research model to fulfill the needs of Western civilization, and little or no consideration to the needs of local population. And now I think after the independence, we continue the same model of of research, the same model of education. But what happened? So it was difficult, the transition to autonomy. We have deterioration of research infrastructure following political and economic issues. So after independence, most of the African countries has all kinds of problems with the population. And political and economic challenges undermine the development of research. Lack of resources, lack also of human resources, lack of transparency and accountability on research opportunities, like a grant, scholarship, and so on. And another problem is the brain drain towards the global north in order to ensure a decent professional and social life. Most of our doctors, when they came here, they obtained their degree, but will not go back because of the fear of what they would find if they go back to Africa. So train research leaving the country for better opportunities in the global north and local NGOs. Yes, so the brain draining is not coming here and stay here, but even in the country, we call that the internal brain drain. They will leave the government to go, they will leave the administration to go to NGOs because they will be well paid there. So they will, we'll have a weak administration, a weak Minister of Health, because the best doctor will leave the Minister of Health to go to the NGOs. And no policy to retain and offer better work environment for researchers. So if doctor came in a country like DRC, he will not find a good environment to work, to conduct research and so on. Because the infrastructure not adapted to current health challenges and lack of funding to support research at the local level. The priorities of our government are not research, but many other problems. Some of the time, these problems are created by the politicians themselves. Yes. So, in fair partnership, we say the colonial model. I can give you a good illustration with the Ebola story. As Stephen said, I was the first scientist to go to the epicenter of the outbreak in 1976. At that time, the disease was not called Ebola, but it was the disease like typhoid fever or yellow fever. And after the description of the virus, they give the name of Ebola. And I remember at that time, all was organized by a consortium of foreign researchers and epidemiologists and virologists from CDC, from WHO, from Institute of Tropical Medicine in Belgium, from the Institut Pasteur, and so on. So the Congolese were there taking care of patients and so on. And when this team arrived, the Congolese has to give the the history of the disease, how it started, and how many people die, and so on. And even the funds are managed by the foreign institution, not the Congolese themselves. And this situation persists even in 1995. 1995, yes, it was the first urban outbreak of Ebola in Kikwit. So I went there by myself, and yes, when I sent message to some partners, CDC, ITM, Institut Pasteur, and to give an alert, and they came to Kikwit. And during the first meeting, I told them, I am the chairman of the coordinating, I am the coordinator of the activities against Ebola, against this outbreak. There was a silence in the room, yes. So they were not so glad for that. Because it will be the first time a Congolese will take the lead. And I tell them that I have the capacity to conduct and to lead this outbreak. And some of them accepted, others are not so glad, but we continue. We continue. And I think, so this was in 1995. And things did not change. Even during the outbreak in West Africa, I was sent there by my president, by the government of DRC, to help people in Liberia. Yes, but it was very difficult to reach Liberia because of because it was not allowed. The plane were not allowed to go there. Yeah, and so we took more or less 3 days to reach Liberia. And when we arrived, my team arrived there with protective equipment, with machine and so on to work. It was not possible to find a place where I can set my my lab, because all the best places were taken by the team, CDC team, WHO, Médecins Sans Frontières, and so on. So, and also, I can say, by chance, I can say that another outbreak started in DRC, and I had to leave Liberia to go back to coordinate the fight against the new outbreak in DRC. So it was very, very difficult for a Congolese to integrate the team in West African outbreak. So most of the time, the decision is taken by the foreign group. And also, yeah, yeah, this is the best example. This is the best example how we develop a banga to treat Ebola. Yeah. Yes. During the outbreak of Kikwit in 1995, my group treated a group of Ebola patients by compassionate. The 8 Ebola patients were treated with a transfusion with the blood of Ebola convalescent. And we were surprised to see that 7 of the 8 patients treated survive. So, but this experience was not accepted by the foreign groups. They refused to cooperate with the Congolese group. And later on, some of them said that, yeah, this experience was not valid because the number of people involved in this were very small, 8, so you cannot conclude. And also, they say, yes, maybe it is true, but it was at the queue of the outbreak. So the virus have lost its virulence. So it is not the effect of the blood transfusion, but the effect that the virus has lost its virulence. And also later on, one of a virologist at the NIH found that Ebola antibodies are not neutralizing in macaque experience. And also in 2016, I think, 2016, during the outbreak in the West Africa, they also proceeded by plasmapheresis. They give plasma of convalescent to patients, but the result was not conclusive. But I continue to believe that something happened with the transfusion. And it is why, in the subsequent outbreak, this experience was not repeated. So, but I continue to believe that something is true in this observation. And in 2006, I met with a scientist from NIH, and we discussed the result of this experience that was published in a serious journal, infectious disease, journal of infectious disease. So we discussed, and the conclusion was that I can send a convalescent to NIH to collect his blood and take the monocyte cells to isolate monoclonal antibodies. So I sent this guy, Mubiala. The selection of this was the key. What do you say there? Yeah, the. La chose la plus importante. Yeah, was what's the, we'll say?
That's with the next case.
No, it is not in next case. It was this was very important to for this experiment. Because the guy developed a severe disease. This is the first reason. And second, with his blood, we treated one of the patients there. So he has antibodies. And also, after he left the hospital, he came back to the hospital to take care of other patients of Ebola. So he was exposed himself many times to the virus. So he developed a very strong immunity to Ebola. It is why we isolated the B cells from him, and we developed the monoclonal antibodies. Thanks to my assistant here, who went to NIH to carry out all experimentation on the blood of this guy. And also, after that, we conducted preclinical studies and in vitro, and also the phase 1 study on human to test the safety and the efficacy of these monoclonal antibodies. So it was very strong, very strong. And during the outbreak in the north of the country, we treat this team of INRB, treat some patients with these monoclonal antibodies. It was 10 patients. All the 10 patients were protected. Yes, were guéri. Yes, were ill. All the 10 patients were ill. And after that, WHO was informed, and our product called MAB 114 was introduced for the RCT. It's a clinic, huh? Yes, it was introduced. And after that, we found that it is the best, one of the best treatment for Ebola. And this product was approved by FDA here in the United States as a treatment of Ebola. But if this observation was accepted at this time, this product will have saved many lives at that time. But it took more or less 20 years to recognize this first observation because it was done by the Congolese team. Do you understand? Huh? Okay. So INRB is struggles implementing its research and fulfill its goal because of the colonial mentality. Not have autonomy of managing funds. What I'm living there, and challenge of integrating Congolese and scientists from the north. Our collaboration is not the collaboration I wish. We need the support of these international scientists and so on, but we must change our mind to see how we can help directly the institution in DRC instead of passing through different mechanisms like NGOs and so on. So we need more equitable partnership. More equitable partnership. And for me, we have two models of partnership. What I'm living in DRC. The first one is a fair model. I can take Japan as a fair model because lastly, we obtained a new building, new facilities with P2 and P3 laboratory built by Japanese corporation, JICA. It cost more or less 22 million. And before the construction, I was personally invited in Japan to assist in the choice of the company that will build the building in DRC. And the choice of company that will pay the machine for this P2 and P3 laboratory. This is, for me, this is the best. I have been interested and I have been involved in all decisions. But most of the time, with European, World Bank or US, they will say, okay, you need a new building. Okay, wait, after 3 years, you will be served. And the building is there, but I don't know how they have choose the constructor or, and so on. So I am like a baby. Huh? You need milk? Okay, huh? I give you the biberon, huh? Take the milk. And okay. As you can see here, we have a lot of partners, a lot of partners. Some of them are from United States, USAMRID. You have NIHC, you have CDC. Where is CDC? Yes. This is on top, I can see. CDC here. You have UCLA, which is University of California. Okay. So this, I think, is okay. They're improving, no? But it's not easy. It's not easy. They will give you. You need machine. They give you machine, but it is not what I want. I want to give me money. I will pay machine that I like. And also from France here, and Belgium there, most of them. And for me, the best is JICA. Okay. Okay, then you can see it is a long road to recognition. Long road. I am maybe the living example of this cooperation. Decades of work not fully recognized, and lack of opportunity to promote research locally. Yes, without the partnership, it is very difficult to promote research locally. And as I show you, our partner cannot believe what you are doing. You African, you do. If they are not there, they will not believe. It will take time. But I think hard work will work. So I think for my example, the integrity and hard work in research pay. Maybe it will take time, but it paid. And confidence on expertise and skills of local research are keys to recognition. I think what I did is to develop this expertise, not by myself, but also I have a team. I have a group of collaborators. When I started in DRC at my institute, I was the only one who has a PhD degree. And today, we are more than 20. And all of my collaborators were trained in Europe, Japan, and America. But we have developed a good scientific environment in Kinshasa. And when they arrive there, they stay in DRC to work. But unfortunately, there is most of the time, no recognition of the scientists from local government, no encouragement for this team. And, but now we have a Minister of Health who is saying that science is the foundation of any development. Without science, DRC cannot develop. And I think things are changing. And I dream that my collaborators, the young collaborators, I say, now we have the first generation, and we are building now the second generation of scientists. They will see the development of science in DRC and in Africa in general. So this is recognition. Muyembe is there, the Prime Minister. The Prime Minister of Japan is there, and the Emperor is congratulating me. It is late, but it is good. Okay, so this is words of wisdom. Africa is ready to engage in a frank collaboration to tackle global health challenges. Funding should be given directly to local institutions to promote good governance. Most of the time they will say, no, you are not able to manage $1,000 given by the foreigners. If I can have a PhD, so I cannot manage $1,000. Local institutions need collaboration, but not help or babysitting. Okay? A new leadership needed to ensure that the resources and skills that Africa has are used to solve Africa's problem. So you use local subject matter expected instead of importing so-called experts who do not understand the realities of the ground. For example, the selection of Mubiala. If you don't know the ground, how can you select Mubiala? You will take somebody who has no antibody to Ebola and send him to America, and the experiment is negative. The result will be negative. So it is important to know the ground and empower the new generation to tackle challenges of, okay, I cannot say racism, but sometimes racism in research and in global health sphere. Okay, so thank you very much.
I think we have about a half an hour for question and answers. So, Professor Muyembe, could you maybe sit here with Jean-Jacques? Who's getting questions from the chat box and from previous questions and questions from the floor?
Yes. So what we'll do is we'll interchange questions from people in the room, also with questions from people on Zoom, also with questions that were pre-sent before the session. So I'll wait until he's ready. So if you're in Zoom, please can you post a question in the Q&A box, please? And if you're in the room and you want to pose a question, there's a microphone to this side of the room. Yes.
For translation.
For the microphone to speak.
Yes.
Yeah. Thank you so much for your talk.
Oh, okay. Ah, ceinture. Okay. Oh. Faut mettre la main ici. Okay.
Okay. Yes.
Yeah, thank you so much for your talk, Professor. That was really great. My question is, as a person who's also coming from the Global South, constantly thinking about ways to decolonize public and global health in my country, in my region, what are your recommendations for researchers in the Global South to start taking more autonomy and ownership of their work without waiting for the global North to help us solve these problems? I know that funding is a huge problem, but in the meantime, what can we do? Like, going back to our countries, what are the things that we can do to help start tackling these problems and solve them? Thank you.
La question c'est par rapport avec la décolonisation, on a parlé. Quelles recommandations donner les chercheurs qui sont formés commencent à faire quelque chose pour l'autonomie quand ils rentrent au pays, pour ne pas attendre que le Nord leur dise ce qu'il faut faire. Je sais que le financement est toujours un problème généralement pour la recherche, mais qu'est-ce que ces chercheurs doivent faire déjà? Quelles sont les recommandations en fonction de ton expérience pour ne pas toujours attendre le babysitting dont on a parlé?
Je peux parler.
Oui, oui.
Tu peux traduire ou pas? Bon, okay, now I can answer in French. Huh? So much time I always speak French. Yeah, c'est-à-dire la plupart du temps, nous blâmons la coopération.
Most of the time we blame the corporation.
Mais nous-mêmes, les Africains, nous avons également la part de notre faute.
But us as Africans, we also have our part of responsibility as fault.
Je pense que si nous avons une bonne formation et que nous possédons notre science, nous rentrons dans notre pays et que nous faisons vraiment les choses que nous connaissons, nous serons respectés et par le gouvernement et par les partenaires.
So if we know, we have knowledge and we know what you're doing and we return back in our country, we start doing what we know as science, a good science, we would start get recognition from our own governments and then by our partners.
Le problème que nous avons, les partenaires disent toujours que nous n'avons pas les capacités administratives de gérer.
Most of the time, our partners say we don't have the capacity to handle either finance or the money or the research.
Parce que nous, les chercheurs, nous sommes habitués à former seulement les chercheurs et non pas à former les administratifs.
Because us, as researchers, we only train researchers, but now the admin people that can help us run research.
Sans une équipe administrative, il est difficile de faire des recherches et d'avoir des financements de recherche.
Without a good administration, it's impossible to run a good research and get funds to run this research.
C'est pour cela qu'il faut travailler toujours en collaboration.
This is why we need always to work in collaboration, having a good administration that can run a good scientific.
Nous pensons aussi que nous devons profiter de notre diaspora. Chaque pays a la diaspora en Amérique, en Europe et ailleurs.
We also need to take advantage of our diaspora. Each country have people who live in the United States, in Europe, and Asia.
Alors, notre politique dans notre institut, c'est de dire comment nous allons transformer la fuite des cerveaux en gain de cerveau.
So our policy here in INRB is to think how we can transform this brain drain and bring those researchers back in DRC.
Oui. Donc, par exemple, Jean-Jacques ici, il a développé une expertise ici. S'il est pensionné, il veut rentrer au pays, nous devons lui trouver une place pour qu'il s'intègre avec l'équipe du pays parce qu'il a une expertise qu'il peut partager avec nous.
For instance, like me, Jean-Jacques, we got expertise here. If I want to go back and work with the country, my country needs to set a space for me. When I come back, I can work with the team and bring what I learned as knowledge and help with the research.
C'est ça que nous appelons transformer la perte de cerveau en gain de cerveau.
This is what we call in INRB, transforming the brain drain to a gain of brain.
Voilà.
Next question is, how do you ensure that researchers, especially those from African countries, receive the acknowledgement for their intellectual property and contribution to research?
La question, c'est qu'est-ce que vous faites pour assurer que les chercheurs africains de la diaspora reçoivent la reconnaissance et le crédit du travail qu'ils font?
Oui. Ça, vraiment, c'est une culture que nous devons développer au pays pour reconnaître et les travaux que les nationaux font sur place et les travaux que les Congolais qui sont à l'extérieur font également. Mais souvent, les travaux qui sont faits ici ne sont pas connus, au pays. Et je vous assure, les chercheurs
doivent faire un effort pour faire connaître leurs travaux à la population. Moi, par exemple, je suis un homme de laboratoire, mais je suis aussi quelqu'un qui parle avec la population, avec les chefs coutumiers. Comme ça, ils savent ce que je fais, en quoi je suis utile. Donc, faites-vous connaître, faites connaître vos travaux, bien sûr par les publications scientifiques, mais également par les journaux populaires pour qu'on soit au courant de ce que vous faites.
So for the researcher, they need first to publish internationally and locally and make the research and the results well known to the public, internationally and locally, but most importantly, to also collaborate with local governments and local staff. We as a local laboratory, I go to talk to the chief at the local level to share what I know and what I have as knowledge. So we need to bring those knowledge to transfer those back so we can reach all the different layers of the community and society. That's where we can get recognition with the work we do.
Merci, Professor. That's all I know. Thank you so much, and it's been an honor to be here. Thank you, Steve. My question is, I know that growing up in Nigeria in the 90s, there was Liberian War, civil war here and there. So, and you just talked about like going to Liberia at that time, taking you 3 days. So I just want to know, how did you stop all your senses, and was able to go to all these places with high rates of insecurity? Because I won't lie to you, a lot of people in diaspora are because there is so much instability and insecurity in Africa, Nigeria especially. In fact, in the past 3 years, many doctors and medical workers have been targeted and killed. One of my professors was killed 2 months ago. It was in the news, so this is like a real fear that people have. So I'm interested in seeing, I know you're very motivated for this, but I don't know how, for example, in my brain, I should leave everything and the relative security that I feel that I'm enjoying here to be able to go work full-time again from northern Nigeria, where Boko Haram is prevalent and a real threat. Thank you.
Okay. Vous avez parlé de l'expérience du Libéria aux années 90. Et moi, j'ai grandi au Nigeria et je sais qu'il y a de l'insécurité dans cette partie du Libéria. Et c'est un problème récurrent. Vous avez dit que ça vous a pris 3 jours pour aller vers ces régions à cause de la sécurité des infrastructures. Maintenant, cette diaspora qui finit, qui a ses connaissances, qui veut retourner au pays, comment vous arrangez pour que ces gens se sentent convaincus de laisser toute la sécurité, l'environnement qui est meilleur ici, et rentrer travailler dans ces conditions où ils connaissent que la sécurité n'est pas garantie, ils ont des risques d'être tués. Récemment, un de ses professeurs a été tué. Comment cette nouvelle génération peut-elle réfléchir et laisser tous les avantages de sécurité qu'ils ont ici et rentrer comme vous voulez, que cette relation s'établisse dans des milieux où il n'y a pas de sécurité?
Bon, c'est ça la question. C'est vraiment difficile. Bon, nous, quand nous avons fait l'essai clinique, clinical trial, avec Ebanga, c'était dans une région d'insécurité, 20 ans d'insécurité. On tue les femmes, on viole les femmes, on tue les hommes, etc. Bon. Quand nous travaillions là-bas, mes gens travaillaient, ils mettent la perfusion, et puis La perfusion coule, mais ils sont par terre. Oui. Et moi, j'ai des vidéos de ça. Ça fait peur. Bon. Mes gens qui ont travaillé là-bas aussi, ceux qui soignaient les malades et tout ça, qui faisaient la vaccination, la nuit comme ça, les terroristes sont entrés. Bon, ils ont tiré aussi, ils ont blessé, ils ont tué aussi une infirmière.
So it's difficult, of course. And I remember when I was doing the clinical trial for the Ebanga product, I went to the region. It was really in a secure region, Eastern DRC, for more than 20 years of conflict, killing people, raping women, and I was working under this condition. Sometimes we have our researcher team was treating people, putting IV pole, treating people, and all of a sudden people that they heard gunshot, they're hiding under the tables. And one time they heard a story when my team of immunization, they went to immunization campaign, and all of a sudden the rebels just erupt and start shooting at people. One of the nurses was that it was terrifying and difficult.
Bon, alors, on a aussi, pendant le travail, on avait tué une infirmière, on avait tué aussi un docteur.
So during this time, they killed one nurse and they killed one doctor.
Là, on avait tué l'infirmière. Une semaine après, je suis parti. Quand je suis parti, je suis entré dans le village. J'ai appelé les gens, les villageois là, et je leur ai parlé. Je leur ai dit, si vous n'assurez pas vous-même la sécurité de mes gens ici, je vais les retirer tous et vous serez tous morts par Ebola. Et ils ont accepté qu'ils vont maintenant protéger les gens, etc. Et on a continué à travailler.
So when that incident happened, the next day I went to the village and I called the chief and brought all the community and talked to them. I tell them, you're in charge of securing my team. If you don't secure my team, I will live with my team and all the village will die with Ebola. And since that day, the community decided to secure my team and no more people were killed and we carry on research.
Voilà. Donc, si vous n'avez pas ce courage-là, si nous n'avions pas ce courage-là, nous n'allions pas trouver les médicaments contre Ebola.
If at that time we didn't have the courage to go back and talk to the community, we didn't have, as we speak today, this treatment of Ebola.
C'est parce qu'on a eu le courage, on a eu cette idée-là, nous sommes restés et maintenant nous avons des preuves que Ebanga, l'anticorps monoclonal Ebanga, peut soigner les malades Ebola. Et Ebola n'est plus une maladie terrible, c'est une maladie curable, guérissable et on peut prévenir par le vaccin.
So we decided to do the job because we went back and now we have this Ebanga, which is a treatment that can cure Ebola. Now we can say we have a cure for Ebola and we can prevent with vaccine. So we can treat people and we can prevent with vaccine.
Je pense que c'est la lutte que nous menons là-bas. Donc, être courageux, montrer aussi à ces tueurs-là que nous aussi, nous sommes forts, nous pouvons faire du bien à la population.
It takes a lot of courage. You're really strong, and also tell those rebel groups that we are strong enough to continue this work and treat people, not to hide behind fear.
Bon, bien sûr, mais moi aujourd'hui, je préfère vous voir vivantes que d'aller vous exposer avec Boko Haram.
Yeah, of course, I want you to be alive than to go back and be exposed to Boko Haram, of course.
The next question, I'll combine two questions. First, thank you very much for your extraordinary work. You've been a pillar for new Congolese and African researchers across the continent. Two questions. One, what do you think is the most important support that Africans need for successful research? And then two, do you think the young generation of researchers can have hope to become as successful?
Deux questions. La première, c'est de savoir qu'est-ce qui est le plus important et le support le plus important que les chercheurs africains peuvent pour conduire les recherches à bon point jusqu'au fin. Et pour cette nouvelle génération, qu'est-ce qu'ils doivent faire pour être aussi bons comme vous l'êtes?
Bon, pour être bon, vous serez certainement mieux que moi. Hein? Pour être bon, vraiment, il faut étudier, avoir les connaissances nécessaires. Et ces connaissances, on les acquiert pas seulement à l'université, mais également sur le terrain. Lorsqu'il y a une épidémie au Congo, demandez à Stephen de vous envoyer là-bas. Je vais vous encadrer et vous aurez une expérience de Ebola. Voyez? Cette expérience de terrain est beaucoup plus importante que l'expérience livresque. Oui. Et
so
alors,
we need to first, you need to study. You need to get the knowledge. You need to study, to go to school and all that. And then you need to get this knowledge and also have this field experience. You get the knowledge for going to school, attending school, having good grade, but you need field experience. Field experience you get it when you go to the field and learn. So we have Steve here. If you want to learn, ask Steve to send you in DRC and I'll be more than happy to have you. I will send you in the field and you can learn. That's, for me, field experience is more important than book on articles experience.
L'autre question, c'est quoi?
Pour cette nouvelle génération, pour qu'ils soient bons comme toi.
Oui, oui. Franchement, c'est comme ça que je vois les choses. Vous voyez, moi pour ouvrir mon ordinateur, je fais ça. Je traîne. Mais vous, c'est déjà un grand changement. Au laboratoire, je fais ça. Hein, ça me prend une journée pour faire une plaque. Mais les jeunes actuels, ça, ils font en quelques minutes, c'est fini. Donc, il y a une façon de réfléchir, de travailler qui est meilleure. Mais bon, le reste, il faut acquérir par la sagesse, par l'expérience. Et bon, hein, vos professeurs sont là, ils partagent l'expérience avec vous. C'est comme ça qu'on apprend.
So new generation are far as us. For instance, when I try to open my computer, I just use my finger. But you guys just open the computer and you tap really quickly. When I go to my lab, it takes me hours all day just to draw a sample and to put in a bottle. But you guys, you take like seconds. You're faster. You have opportunities, but you need to get some wisdom from your professor because they have a lot of experience and hear what they said. And that's why we can be successful.
Donc, le contact, nous, on a l'expérience. Nous, les vieux, nous avons l'expérience. Vous, les jeunes, vous avez les connaissances, vous avez l'habilité, hein, etc. Bon, essayez de mettre tous ensemble.
So to be successful, you have to combine both. You have the skill set, the technology, and you have to combine this with the wisdom and experience you have so you can be successful.
Thank you so much for your talk. My name is Mogaka from Kenya, and I am happy to meet you today to listen to you. I've read about your story before. So my question is this: you're part of the first group of African researchers or post-experience who are recognized. I mean, who have been the pioneers of our research institutions. And for me, I work with Cambridge, which also started I think in the late 70s or early 80s, which is around the same time. It must be the same age with your institution. So my question is this. My question is a bit different. So I want to ask, in what way researchers from your time or of your generation who are exiting have been, because there are two sides of the coin. So I want to know, so that we can learn, we are the young researchers, how have you been, in what ways would you identify you've been complicit in having these unequal relationships? From your experience, if you look back, in what way would you say you have been complicit in having what we have today, so that we can learn from that? And one of your developments recently, other than recognition, is that I've seen you have gotten a patent for your discovery. So this idea of the patent that you've gotten, do you feel like this should be the way forward for African scientists, given that our philosophy is more of societal in the spirit of Ubuntu? And now that you have an IP, how does this fit into the future, into our future, and do you feel this is the way to go? Thank you.
Tu as deux questions. La première, c'est comme vous êtes de la vieille génération, quand vous voyez le travail qui a été fait, qui s'est fait dans cette génération, est-ce qu'il y a des choses que vous avez apprises à travers le temps qui pourraient aider à faire différemment? Et puis l'autre, c'est par rapport au brevet. Récemment, vous avez reçu le brevet pour la molécule Ebola. Et dans notre culture africaine, nous avons toujours parfois certains cachent des histoires et dans la communauté. Comment est-ce qu'on peut travailler de manière collaborative dans notre culture africaine, sachant que généralement, des chercheurs essaient de garder pour eux ce qu'ils font comme... Donc, quand vous faites un regard dans le passé, votre recherche, approche, comment vous êtes arrivé jusque-là? Est-ce qu'il y a des leçons personnelles que vous avez tirées? Et c'est par rapport au brevet, à la reconnaissance, ça des brevets, il y aura prix, comment gérer cela?
Vous voyez, il y a quelque temps, cette question m'a été posée par les Congolais. Alors, ils m'ont dit, professeur, est-ce que les bangas, c'est le hasard? Vous avez fait ça par hasard ou bien c'est quoi? Bon, moi je lui ai dit oui, c'est par hasard. Mais, comme a dit Pasteur, il n'y a que les esprits, le hasard ne favorise que les esprits qui sont préparés. Si vous avez été préparé, vous trouvez des choses comme ça, c'est comme si c'était par hasard. Le hasard ne va jamais favoriser quelqu'un qui est, par exemple, qui n'a rien fait et puis se retrouve comme ça devant Ebola. C'est impossible. Parce que moi, quand j'ai fini mes études de médecine, je suis parti faire mon PhD en Belgique. J'ai commencé en 69. En 69, mon travail, c'était de traiter les souris avec un produit que nous pensions être un antiviral. Donc, j'ai commencé à ce moment-là. Et j'avais trouvé un produit qui pouvait donc empêcher les souris de mourir d'une infection virale. Ça, c'est les souris. Maintenant, arrivé au Congo, je ne pouvais plus continuer l'expérience avec les souris. Dans les laboratoires, il n'y avait pas d'animaux de laboratoire et il n'y avait même pas de paillasses pour travailler. C'est comme ça que je me suis transformé en épidémiologiste de terrain pour courir derrière les épidémies. Ah, oui.
Yeah, so I got this question most of the time of my people ask me, how did you discover Ebola? I say, okay, by chance. And like I can quote one of Louis Pasteur researchers said, I don't know what to say in English, le hasard favorise les esprits avertis. So I took, thank you, Karen. So going back, when I look back, I took when I finished my medical school in the University of Kinshasa, which was back then Lovanium, I went to Belgium for my PhD. I had my PhD in 1969, and the work for my PhD was to find a treatment for a viral disease using mice. So I did this research in lab, and I got my PhD. But when I went back in Congo, I could not do the research using mice because there was no infrastructure to do those type of research. And I quickly shift to be a field epidemiologist, hunting diseases and outbreak. That's how my patients start and when I start this field of doing this research.
Okay, unfortunately, we are running out of time. We'll take one more question from the audience.
Bonjour, thank you. My question goes back to a slide that you had where you showed the Journal of Infectious Disease. And you talked about the barriers and the criticism of your research when you first started researching the potential cure. My question now is, for many of us in here who are young researchers, it doesn't matter how well we are trained to be researchers or what discoveries that we come up with if we can't disseminate those findings in a way that amplifies our own voices. My question is, to what degree do you think journals themselves, like, you know, the Lancet, Journal of Tropical Medicine, Journal of American Medicine, to what degree do you think that the journals themselves have perpetuated some of the barriers in diffusion of innovation? Innovation is more than just technology. So the second part of that question is, not only do you think they've been barriers, but to what degree do they play a role in decolonizing global health and opening up the space for researchers and scientists from the continent to be recognized in terms of their own brilliance and their own capacity? It's one thing to say, well, Africans can start their own journals, but as we've seen, there is an elitism within the journal community itself. If you're published in an African journal, it's seen as less than if you're published in an American or a Western journal. So I really want to get back to this journal discussion, because many of us, especially those of us who are PhDs, we have to publish. It's part of our training. But if we're not recognized in those papers, then I think it doesn't really matter how well you're trained as a researcher if your findings are siloed or not even presented. And lastly, as Africans, we need to quote ourselves. Many journals you'll see, even within the African continent, they don't quote other Africans, they'll quote some European. So these are, I think, are all interconnected issues, but I very much believe that they're connected to some of the challenges that you've experienced and your lack of recognition. Thank you.
Très intéressant. Dans une des diapositives, vous avez parlé du problème que vous avez de reconnaissance de votre travail. Et le problème que nous avons ici, c'est on peut être bien traîné, bien formé dans la recherche, avoir de très bonnes études faites, mais le problème, c'est que parfois, nos travail dans la dissémination de nos recherches, nous avons un problème, parce qu'il y a des barrières, parce que les journaux eux-mêmes continuent de perpétuer cette idée coloniale. Les journaux choisissent parfois quel article publier. Et même quand vous êtes en Afrique, publier dans un journal africain, comparé à un journal européen ou américain, par exemple, le Lancet, si vous préparez dans un journal africain, ça n'a pas le même poids, ce n'est pas considéré. Comment vous considérez cette situation? Même si on se bat, on fait des recherches, on fait des publications, mais si ces publications n'ont pas le même poids quand ils sont publiés en Afrique, en Europe, ou quand nos recherches, nos travaux ne sont pas disséminés pour qu'ils soient connus et valorisés à juste titre que ceux-là, c'est comme si nous prêchons dans le vent. Qu'est-ce que vous en pensez?
Bon, voilà. Si vous avez choisi la carrière de chercheur, c'est pour innover, c'est pour publier. Et tout chercheur va chercher un journal avec un impact factor élevé. Pour être connu en tant que chercheur dans votre domaine. Et nous tous, on a fait ça. Vous envoyez dans tel journal, on refuse. Vous envoyez dans tel journal, on refuse. Hein? Finalement, il faut chercher un cimetière qui peut recevoir votre publication. C'est là les frustrations de la recherche. Mais on ne peut pas refuser si votre travail est vraiment bien. Moi, je ne peux pas sentir qu'il y a le racisme parce que vous n'allez pas publier seul. Si on voit que seulement Muyembe Tamfum, on dit c'est l'African name. Mais s'il y a dedans Stewart Gloyd, ils vont dire, ben, c'est quand même. Hein? S'ils sont racistes, alors il n'y a plus de racisme à ce moment-là. Parce que tous les noms sont là-dedans. Donc, il faut faire confiance, n'est-ce pas, au comité de lecture qui vont donc sélectionner votre journal. En Afrique, bien sûr, nous n'avons pas encore de journaux vraiment avec un impact facteur élevé. Donc, moi, je dirais ceci. Si vous avez fait des recherches de haut niveau, vous voulez publier ça dans les journaux, je ne sais pas moi, le Public Health, New England Journal ou bien Lancet, des choses comme ça. Bon. Mais si vous croyez que votre sujet n'est pas vraiment tout ça, en Afrique, nous avons besoin aussi de connaître ce que vous faites. Vous pouvez également les publier en Afrique. Et moi, je pense, ou bien vous avez publié déjà dans le New England Journal, mais maintenant, vous voulez vulgariser ça. Que les Africains aussi puissent suivre ce que vous faites, mais vous faites une autre version pour le publier dans les journaux en Afrique. Nous avons besoin de connaître ce que vous faites ici. Il ne faut pas venir en Europe et puis disparaître dans les méandres, dans les nuages. Hein? Ici, à Seattle, je n'ai pas vu de nuages, mais enfin, hein? Vous voyez, c'est ça qu'il faut. Vraiment, il faut disséminer ce que vous faites. Votre travail que vous faites, nous avons besoin de connaître ça. Nous avons besoin de connaître ça. Et si jamais vous voulez venir en Afrique, par exemple au Congo, nous avons des Américains qui viennent d'Alaska, qui viennent au Congo travailler. Mais il y en a un qui m'a dit, ce que vous avez ici au Congo, nous n'avons pas en Amérique. Bien, je trouve que c'est mieux de travailler ici que de travailler. Oh là, vous avez un traducteur ici.
I'll try to summarize some of the questions. I couldn't keep up, I'm sorry. So, Dr. Muyembe said, if you choose the path or be a researcher, you should be prepared to be frustrated. Okay, you cannot be ups and downs in research, but if you choose this path, you should be prepared for those one could happen. And if you want to publish something, you need to choose always the journal was like an high impact factor. You know, a journal will be well recognized in the field. If you want to be recognized in a particular field, then you need to choose a journal well known to be recognized. And if you feel like your research is a high level research, you should target those particular journal to publish. You can be rejected. I've been rejected so many times, but this is the game of the research. Your work can be rejected, be prepared. I don't think there is a racism in research, but be prepared and be aware. And also we need to disseminate, like you said, disseminate your research in Africa. You can choose also journal in Africa to communicate what you do. In Africa, we need to know what you're doing here. Not come to the United States, get trained and like disappear in a cloud. We don't know what you're doing here. If you have something, if there's like a research not really high level, you can publish them to the local journal in Africa. But the word is to disseminate your work so the community know what you are doing in your research.
Yes, I think so.
Okay, thank you so much. Merci beaucoup, Professor. Merci, Jean-Jacques. And thank you for everyone who attended the session and came with amazing questions. I will now call back our amazing Dean Hillary to close our session.
I just wanted to express my intense gratitude, Professor Muyembe, for your words here today. It's an honor to have you here talking about your work, but just so important for you to have the opportunity to raise what are really critical issues within our field that need to be addressed, and just so refreshing to have this frank and open conversation. So thank you so much. Merci beaucoup, Jean-Jacques. Merci. And thank you everyone thank you for the great questions. You guys really fantastic. And many thanks to all the folks online and Claire for moderating the questions. Thanks.